transformative impact of artificial intelligence in the field of medicine by Dr. Melvin Speisman. Now, I will say that since this is a lecture about AI, I use ChatGPT to generate my entire introduction. Dr. Speisman is actually the president of American College of Artificial Intelligence and Medicine. He's also an assistant professor of medicine at the University of Illinois, Chicago. Going back to his further earlier education, he did his undergrad at Northwestern Evanston with a double major in biological sciences and chemistry. He did his medical school at the University of Illinois in Chicago, and he completed his internal medicine residency at Northwestern Hospital. He then went on to do his chief medicine year at West Suburban Hospital. And after that, he became one of the first hospitalists in the United States and core faculty to the internal medicine residency at West Sub for over 25 years. Going on to some of his main achievements, Dr. Speisman is a specialist in academic internal medicine. He's renowned expertise in diagnosing and treating chronic medical conditions such as hypertension, diabetes, and coronary artery disease. With a passion for medical education and a commitment to outstanding patient care, Mel has been recognized for his numerous awards and has mentored many physicians and leadership roles. Currently, Mel is focused on the intersection of AI and medicine. He has completed certificates and programs at MIT, Northwestern University Kellogg School of Business Management, and is enrolled currently at Harvard University's AI and Medicine Certification Program. His goal is to become a world leader in innovative field by furthering his education at Stanford's Artificial Intelligence and Healthcare Certificate Program. Please join me in welcoming Dr. Melvin Speisman.
Thanks for that wonderful introduction. Very excited to be here. I'm born and raised in Chicago, and you may or may not know that Mercy Hospital is the oldest hospital in Chicago. That the Sisters of Mercy came from Ireland. 6 of them came to Chicago, and in the mid-1800s formed the first hospital in Chicago in the mid-1800s. And I am so excited to be here now to talk to you about the next phase in medicine, which is the intersection of artificial intelligence and medicine, which I'm sure you're all familiar with. So I have no financial disclosures or conflicts of interest. In terms of preparing for this talk today, in the last few months, I've done certifications at Northwestern Kellogg School of Management, MIT, AI and Healthcare Program, and today is my final day of the Harvard AI and Healthcare Program. Just to give you an idea that some of the information from my talk is inspired by these certificate programs, and so it's very cutting edge, all within the last few weeks to months. If you took one message home from today's talk, if you could just remember one thing, what would it be? That you, as a physician in this room, to do AI and medicine well, need to collaborate with computer scientists. Those computer scientists might be those that are trained in natural language processing, those that are biomedical engineers, those that are physicians that have done fellowship in medical informatics. So AI in medicine is a collaborative space. It's very cool because people who are computer scientists look at the problem from one perspective, and then we make it clinically relevant. So without that collaboration, you can't really do well with AI. This is a residency program here at Insight, and I do want to offer to those residents, if you're interested in doing a research project in my lab group, you can email me. This is my email. Or you can come up after the talk and I'll give you one of my cards. August 7th, I wanted to be very up to date. What's happening in August in this field? The FDA published an updated list. There's now 950 authorized AI-enabled medical devices. Interestingly, 76% of them are for radiology, and the rest, 10%, are cardiology. So Most of the approved AI devices, and when we say devices, we're talking about algorithms, are for radiology and cardiology, and they're mostly in the imaging world right now. And we'll talk more about why that is. I went to medical school here at the University of Illinois, Chicago. And the other day I found this cornerstone. Again, you could tell I like some history. I won't dwell on it, but this is the cornerstone that was laid in the 1800s when the college was founded. So the cornerstone is at the bottom of a building. I'm interested in architecture. The very last stone that's placed on the top of a building is called a capstone. Why this is important is a lot of people in AI space that do projects in academia, like I have been doing, do a capstone project. It's the final part of your education. It's like sending you off into the world now. So the one that I've been working on has to do with, I'm really into teaching heart guidelines. The last 25 years, most of my teaching is around guidelines relating to heart failure, MI, atrial fibrillation. So my vision is to use AI to have physicians get with the guidelines, meaning adhere more to all the finer points. So I won't dwell on what a capstone project is. We can talk about that privately if you want to, but today was the capstone projects at the Harvard Medical School, and it was done on Zoom, and it was pretty exciting. So I want to give you the backstory of how we got here today, but just very briefly. And it starts in World War II. And this scientist, Alan Turing in England, is very important to why we can do AI in medicine today. The German army had a machine to basically, encode or encrypt messages. So the US and the Allies needed to decode those messages. So Alan Turing did that in England by creating a machine, and his machine was the first computer. Why that's important is that every year now there's an award similar to the Nobel Prize called the Turing Award. And many of those that are responsible for AI in medicine today are recipients of the Turing Award. The term artificial intelligence started at Dartmouth. It was a summer project. I've been doing some summer research projects with my students. Some are undergraduates, some are medical students. So at Dartmouth in the summer of 1956, just a handful of professors got together and thought, well, in 8 weeks, we'll figure out how to do artificial intelligence on computers. Well, it took more than 8 weeks for us to get here, as you can see. But they thought it would take them 8 weeks. So that's where the word was first used. I'm going to quickly run through terms. If this is too quick for you or not detailed enough, feel free to meet with me privately, and I will go in detail. I'm just going to quickly run through this. We have people obviously of a lot different levels of understanding and learners of different levels. So I don't want to bore anyone, but I do want to mention these things. So a neural network is key, which is a machine learning program that mimics the way neurons work together to arrive at conclusions. The person that invented the neural network is still alive, and he is the most respected person in artificial intelligence in the world. And this is what we call him the Godfather, Jeff Hinton. So until recently, Jeff Hinton worked for Google, and he just very recently retired from Google. But it's his work and his vision in the 1970s that allow us to do AI today. And he envisioned a way to mimic the way that neurons in our brain work. And that's called a neural network, an artificial neural network. So he started working on this in 1970. It took him a long time to make this a reality. He did this work at the University of Edinburgh. I plan to visit the University of Edinburgh in October. I think it's going to be cool. So in Scotland, he came up with this idea. So more things about Jeff here. Number one is in 1996, he published something that gave him that award that I told you about, and it was the idea of backpropagation. That's what allows ChatGPT and LLMs to actually do the work they do today. And even more importantly, his students, Alex, designed AlexNet, which is basically something we now know as computer vision. So the only reason that a X-ray can be read by AI is because of computer vision embedded by Alex. The only reason a cardiac image can be read by AI is because of computer vision. So these are the most important breakthroughs that allowed us to do AI in medicine today. I'm pretty optimistic or positive about AI. People who maybe aren't that deep into it are fearful of it. And even Jeff, who's responsible for all of this, left Google in part because he wanted to be able to speak freely about the risks or potential dangers. And that could be a whole other topic for discussion. And I'm happy to have that conversation with you guys anytime. But in 2018, he was given the Turing Award, which was a big deal for backpropagation. And he was given that award with these two other computer scientists. Now, Jan LeCun developed convolutional neural networks, and that also allowed for computer vision, image recognition, object detection. So we talked a little bit, these are just definitions so you can understand my talk. So machine learning, using data and algorithms to imitate the way humans learn, gradually improving with accuracy. Deep learning, a subset of machine learning that uses multi-layer neural networks to simulate complex decision-making. And unsupervised learning, algorithms that analyze unlabeled data sets to discover hidden patterns without the need for human intervention. And large language model, you use it, because I'm sure you're using ChatGPT. That's an example of one large language model, but there are many others that are out there. So it's a computer program that has been trained on data to recognize and interpret human language. So to give you an example, if you saw a patient right now and had some unusual findings, let's say they had 5 unusual findings and you don't know what they have, it's like, seems like something rare. If you type those unusual findings into ChatGPT right now, it has been trained on basically the entire internet, and it will be able to then give you a diagnosis of a rare disease that you would otherwise be unable to figure out on your own. And that is the power of AI in medicine in that example. So in November 30th, 2022, we're coming up on 2 years soon, is when OpenAI released ChatGPT-4 to the general public. And that is when the world was transformed. And everyone that I know, regardless of whether you're a physician or whether you're a lawyer or whether you're a business person or whatever you may do, this large language model can help you. So many people are afraid, is it going to replace me? Am I not going to be a doctor anymore? Of course not. It's a tool. The best way I can have you think about it is the stethoscope. We all use the stethoscope. Everyone here in this room uses the stethoscope every day on every patient to examine them. Well, this will be the modern day stethoscope, a tool that will help you diagnose and treat patients more effectively. And also help you engage more in an empathetic way so you don't have to be glued to the computer during the visit. We'll talk more about that at the end. So what does GPT mean? It means generative pre-trained transformer. Computer vision, I already explained, a neural network. Machine learning teaches computers how to obtain digital images and videos to interpret them. Generative AI, which you hear a lot about every single day on the news constantly, is generating new images, new video, new speech, new text, new music. And this is part of our daily lives now 24/7, whether we want it to be or not. So generative AI is a neural network architecture of transformers that uses unsupervised learning, large foundation models, and then interestingly, it outperforms benchmarks. And what I mean by that is It can outperform what a radiologist can do. It can outperform what a pathologist can do. But instead of being afraid of it, we should use it as a tool to help our patients. That's my message. I'm an AI for good is my motto. Autonomous AI we'll discuss because the first application of AI in medicine in the world was autonomous AI. The case example will be in diabetic retinopathy, which is the original work in AI in medicine. Now, a computer, rather than a human, makes the medical decisions in autonomous AI. Now, one thing I want to share with you that is, I think, really important, this is the second thing I want you to remember from my talk today, is that you should always supervise AI. You should always supervise. So in other words, right now at Rush and Northwestern, AI will write the note when you're in the room. You'll come out of the room and AI will have written the note. You need to read every word of that note as if it were a medical student. And there may be some, what we call hallucinations, where something is almost confabulated that may not be true. So always supervise AI. That's my second message. So my first message was partner with people in computer science to do this work. My second message is always supervise AI. But can there be unsupervised AI? Yes. And that example is in the eye. And the actual person that did the most in the world of artificial intelligence in medicine was Mike Abramoff. And Mike is an ophthalmologist at the University of Iowa. And he figured this out in 2010. So the real AI in medicine started 14 years ago with Mike Abramoff. And what did he do? He used computer vision to look at an image of a retina and say diabetic retinopathy is present or absent. That's all. Without a doctor. And it took him 10 years to get this to be an FDA-approved device, but it is now an FDA-approved device. It is the first FDA-approved device for artificial intelligence in medicine. So in 2018, he published like a more up-to-date trial on using it in primary care. This is the reference in Nature if you want to look at it. I'm happy to share that with you. So the other one that I want to tell you about that's autonomous AI is Lily Payne. Now, Lily is really interesting. Lily went to medical school, but she didn't do residency. She started working for Google. And while working for Google, she did a similar project where she had Google develop a system that could look at the retina and diagnose diabetic retinopathy. But the cool thing that Lily did is she tested it in rural towns in India where there was no access to care, and in rural towns in Thailand where there was no access to care. And this is my AI for good that is like motivating me to want to do this and help people worldwide, is that you could have this technology screen for diabetic retinopathy in a small town somewhere in the world where there's no access to care and prevent blindness. I mean, imagine the power that this has. This is unbelievable. And when I tell you about this, I think of John Lennon and his song Imagine, because it's imagine what can be possible with this. This is like, what would we call it? Like a case example of what is possible with AI in medicine. So Lily now is the director of AI for health for Apple computers. So she's like top of the line person. So a lot in ophthalmology that we can talk about, but we are at a point where it could be used very well now to screen for diabetic retinopathy. So think of it this way. Most of the AI work in medicine is through computers reading images. So the first image reading that the case example was the eye. The second one is radiology. If we can use it to read an eye image, we can use it to read any x-ray. Think of that. So this guy, Pranav Rajpukar, who's a PhD, came up with a system to read x-rays, specifically chest x-rays. He was at Stanford working with Matt Lundgren, and he came up with CheckNet, a 121-layer convolutional neural network that was trained on 100,000 chest x-rays over 14 diseases. The diseases it was trained on are atelectasis, pneumothorax, cardiomegaly, consolidation, effusion, edema, infiltrate, emphysema, mass, fibrosis, nodule, pleural thickening, pneumonia, and hernia. So he trained it on these diseases with 100,000 x-rays, and guess what? The AI computer vision will beat any radiologist on this always. And what's really interesting is when they did some of these studies, they found that the radiologist may have been as good as the computer when they started in the morning, but when 3 o'clock came along and they started to get fatigued, maybe they weren't as sharp, but the computer wasn't getting fatigued later in the day. So just an interesting, subtle point there. So when I was in medical school, this was 30 years ago, I went to school with a guy named Bill Gallanter. And I returned to UIC as an assistant professor a year ago, and I ran into Bill. And he has been one of my mentors in all of this for the last year. And he views himself as a physician scientist, PhD, who's primarily views himself as a mathematician. And actually, one of my friends is here who's a mathematician at the University of Illinois. Also, one of my patients, one of the professors of mathematics is here. I invited him here. Well, Bill, like yourself, views himself as a mathematician first. And many people in AI and medicine are that way. And someone came to him, a radiologist came to him and said, "Hey, Bill, I found a way to diagnose diabetes from a chest x-ray." Doesn't that blow your mind? Diagnosed diabetes. It blows my mind. I hope you find it interesting because I find it unbelievable. So Bill and Brian Layden rather, and Ayas Pyros published in Nature how to diagnose diabetes from a chest x-ray. And these are patients that have no symptoms. So they don't know they have diabetes. They're not symptomatic yet, but a screening chest x-ray could find diabetes. This is phenomenal. So if we can use it for ophthalmology and we can use it for radiology, we can use it in pathology too. For example, if you let computer vision look at a pathology slide, it can tell you about the prognosis, the likelihood of recurrence, the likelihood of survival, just by looking at a singular path image of a biopsy specimen. Say, this was a study in colorectal cancer biopsies. And it could predict recurrence-free survival. Actually, most of the randomized trials and most of the true scientific data, the kind that I value as an evidence-based physician, are in the world of gastroenterology. So right now, if you would go to have a colonoscopy done, the colonoscopy that is being used has an AI computer vision attached to it. And it will detect the polyps that the gastroenterologist may miss. So these are just some numbers. Studies show that the adenoma miss rate is 26%. So it says adenoma detection with computer vision is 36%, and without is 25%. So on the 4,000 patients, they were able to prove that if you add computer vision to a colonoscopy, you basically can detect more polyps that the gastroenterologist may have missed. And so this is well known in the gastroenterology world. At the University of Illinois, we had a grand rounds where we invited a professor from Harvard who was the first to pioneer this. And basically, at least at the academic centers, I know for sure, they all are using the AI colonoscopes, but I think it's pretty standard now in the GI world to use an AI-enabled colonoscope. So again, what in medicine is image-based? We talked about ophthalmology, images of the eye, radiology, images of the chest, images of a biopsy, images during a colonoscopy. Dermatology, another image-based. So skin lesions can be read with AI. So one of the top people in AI in medicine is a dermatologist, Roxana. She's at Stanford. She only does a half a day of clinic a week, and the rest of the time she does what I do, work on AI in medicine. And she tends to focus on algorithmic bias. And she actually published a fabulous paper that I want to recommend to you, not about dermatology, but about using LLMs in internal medicine. It was published in the Annals of Internal Medicine. So if you want to read a great review article about LLMs from January 2024, this is large language models in medicine, the potentials and the pitfalls, a narrative review. I highly recommend you read Roxana's paper. That's the journal that's published by American College of Physicians. That's the organization that I'm a fellow of. The part that excites me the most in AI and medicine is cardiology. That's where I focus my energy. Most of the top people in AI and medicine are working in the cardiology space now. Ian Ashley is one of them. Next month, he will be taking a position as the chairman of medicine at Stanford. These are some of the things he's done. He's done deep learning of LV abnormalities from a chest x-ray. In other words, he can have computer vision, look at a chest x-ray, and tell you what the ejection fraction is. That blows my mind. I don't know what you think about that. He has deep learning to detect low ejection fraction on an electrocardiogram. So we can have computer vision, look at an EKG, and tell us the ejection fraction. That's unbelievable. He has deep learning outperforms experts in identifying cardiac wall motion abnormalities. So reading an echo better than a cardiologist. Deep learning identifying myocardial dysfunction from an EKG. So you can see that any kind of imaging, an EKG, an echo, a CAT scan, anything that relates to the heart that's an image, AI will outperform a physician. Don't be afraid of it. Use it as a tool. GI doctors, the gastroenterology world, are all using it as a tool to improve their colonoscopy adenoma detection rate. Nothing wrong with that. Don't be afraid of it. Use it as a tool. It's like a stethoscope. It's going to make you a better doctor. I only emphasize that because when I do a talk like this, most of the questions at the end are about fear. And I'm just telling you, as a physician, don't be afraid. Embrace it as a tool that can help you and your patients. Eric Topol was invited as the keynote speaker at this year's American College of Physicians meeting. He was the keynote. So I have attended every American College of Physicians national meeting for the last 25 years. This year, the keynote was AI in Medicine by a cardiologist, Eric Topol, who runs Scripps. He still teaches cardiology fellows, but he is probably one of the best in the world in AI in medicine. And his keynote address was amazing and very much inspiring for the work that I do. If you want to watch a TED Talk that is 14 minutes long and will tell you everything you ever wanted to know about AI in medicine, which is similar to his keynote, please, I would encourage you to go and do a search of Eric Topol and TED Talk. And it's 14 minutes long, and it will tell you everything you ever would want to know about AI in medicine. It is so amazing. He's such an incredible physician, cardiologist, mentor. I'm going to just give you some key points from his presentation, which is AI can read an EKG, AI can determine the EF from an EKG, it can predict AFib by looking at an EKG in someone who has never had AFib. Can you imagine it could look at an EKG and predict AFib in someone who has never had it? It can detect diabetes from an EKG. It can detect hyperthyroidism from an EKG. It can detect kidney disease by looking at an EKG. It could detect anemia by looking at an EKG. I have the journals that these are from. Happy to go in more depth with you guys. So if you look at this, you're like, how is this possible? Well, right now, at least where we are, even at the highest level, Eric and Ian and myself will tell you that this is called unexplainable, but true. And we don't like things we can't explain, but that's where we are. I'm hopeful that at one point we will be able to explain. What about in primary care? Well, the reason I'm bringing this up is in March, Rush started using an AI-enabled progress note writing. There's a company called Suki that they outsourced to. So now one of my former chief residents, who's now at Rush, she's a primary care doctor, Patty Grant. She uses the AI-enabled note writing every day. So instead of being glued to a computer screen, typing, she's able to make eye contact and connect and show empathy and not be burdened by being a data entry clerk. Imagine what that will do to make your life as a physician so much better. So not only is this happening at Rush, Northwestern as well. Northwestern started a department of artificial intelligence and medicine. And they developed their own version of what Rush has outsourced. They have their own that they patented and connected with Microsoft. So if you go for a primary care visit today at Northwestern Memorial Hospital, the doctor doesn't have to type into the computer. You could just, it's just AI. It's like an Alexa speaker. It listens to the conversation. It assembles it into a note. It creates a problem list. It does the coding. It does all the billing things. So what do you do then? You just can talk to a patient. It brings you back to the reason why you went to medical school in the first place. Amazing. This is reality. This isn't fantasy. This is what's happening now in Chicago at 2 large medical centers. And hopefully we'll be coming to a theater near you soon. In my Harvard class that I just finished, many of the classmates are now partnering with me and working in my virtual lab. One of them at Banner, which is an academic center in Arizona, is using the AI-enabled note for hospitalists as of the last few weeks. And we're about to publish data on this, that it is catching a lot of errors. Medicines that were held or stopped for procedures. Example, enoxaparin that a patient was on for DVT-PE chronically was stopped for a procedure and not restarted. The AI note alerted the doctor when he was typing the progress note, and then he reordered it. That's one example, but we actually are going to publish about 5 or 6 examples of how an AI-enabled progress note will allow you to increase patient safety, improve patient care. I find this to be absolutely amazing. So I've given you the science behind it. I've shown you what was the backstory, what was currently done, where things are heading now. I just want to give you my own personal thoughts on this topic. So what's its impact on medicine? Medicine is about to be transformed in ways that are unimaginable, using artificial intelligence as a tool to solve problems. The use of natural language processing with a transformer model will allow physicians to explore massive amounts of data in the patient's electronic medical record to identify opportunities to improve patient care and reduce mortality. So to this end, Epic is working very intensively to implement AI within the Epic itself. Many startup companies are trying to do the same to give to hospitals and health systems. So what is AI's impact on medicine? Again, these are just my own thoughts, that machine learning algorithms apply to images of the retina, chest x-ray, pathology biopsy specimens, and EKGs will allow us to identify diseases in ways that are currently unexplainable. And I gave you the examples of that just a minute ago. Using AI to solve problems in medicine requires a collaborative team. I started the talk with this idea. I'm ending the talk with this idea. You cannot do it alone. You should not do it alone. I have equally people working with me that are physicians and computer scientists, biomedical engineers, medical informatics physicians. That team of computer scientists that know NLP and physicians that know the clinical relevance can identify important clinical problems that need to be solved. And this is truly transforming what is possible in medicine. So for me, just as the day that the Sisters of Mercy started this hospital in the mid-1800s was a momentous occasion, this moment in time, I have no doubt, is a momentous occasion, a magical moment in time where breakthroughs are happening at a pace unheard of in the world of medical research. Anybody that looks at the publication rate on this, it's purely exponential. It is happening at lightning speed, and it is so cool to be involved with this work. My goal in all of this is a lot different than others. Most people that I know that are in the AI space are trying to form a company and make profits and turn it into cash. My goal is different. It's to mentor and encourage you as much as possible to learn about the intersection of artificial intelligence and medicine, and join me on this journey that literally will boldly go where no man or woman has ever gone before. So how can you do that? Well, I have a virtual lab group, and some people in the room are already part of that virtual lab. The chief residents of Insight residency program are in my virtual lab group. Some of the other residents already have joined. I have medical students all across the nation that have joined me through AMSA, the American Medical Students Association. Many of the leaders of AMSA students are working in my lab. I have professors all across the nation, from my MIT course, from my Harvard course, that are working in my lab. And we are working on every subspecialty within internal medicine. So if you have a certain interest, you're welcome to email me and request joining the lab group. The lab group is part of a bigger thing that I'm doing, and I'm actually launching it this week. And this talk today is the beginning of me launching the American College of Artificial Intelligence. In some ways, it's being launched here at Insight today. It's about to go live, and if you're a student or a resident, there's no charge because we're not for profit, as I told you. And I'm structuring it in a way very similar to the American College of Physicians, in that we will have a national meeting every year. We will have a journal. In addition, to make it much more relevant, there's going to be regular podcasts. There's going to be ongoing virtual lab group meetings with lots of publications on every aspect of medicine. And most importantly, my mission is to mentor and teach. And so I will be teaching AI in medicine at almost every residency program in Chicago through a monthly lecture series. So Dr. Alaga, Dr. Mason Carilla have been kind enough to allow me to come here once a month and talk about each subspecialty in depth. So, for example, AI in cardiology, AI in pulmonary, AI in critical care, AI in nephrology. So I will have 10 topics that I do per year, and we will go in depth, and it'll be very evidence-based, based on studies. So I'll be doing that at the residency programs as well as the University of Chicago Medical School, the University of Illinois Champaign Medical School, and other places. So if this is something you're interested in getting involved with, feel free to reach out through email. And we will have a website launching in the next week or two that will have more detailed information about it. But I'm going to open it up for questions because this is an area where there could be a lot of good discussion. The best part of the AI in medicine is actually conversation around it. So I'm actually going to turn on the lights here and open it up for some questions. Ahab, if you could moderate the questions, since you know everybody in the room here as the program director. Ahab was a chief resident when myself and Dr. Carrillo were the core faculty of West Suburban Hospital. And I am so honored that he is inviting me here to speak to you guys today. Thank you. Yeah, we're going to give you this mic. I don't know if it reaches.
I don't think it will reach.
Then you bring it back. I think it's. Okay. Just talk loud. I'll repeat the question for the audience.